Hello, everyone. Thank you so much for helping on. My name is Ransom Anima. I'm a final year radiography student, a medical writer, and also a YouTuber. Um, Today, I have an amazing guest speaker all the way from the UK. Her name is Dr. Julie. I will give her the platform to introduce herself. So, Dr. Julie, could you introduce yourself to the audience?
Okay, so hi, I'm Dr. Julie. I'm a GP. I call myself a portfolio GP because I tend to do a few different things. So I'm a GP. I'm based in Kent and London, and I'm extremely passionate about women's health, mental health, and also health equity. And because of my passion in these topics, I do hold a wide range of roles. So this includes being a clinical entrepreneur, where I'm currently developing a health literacy app, which I'm sure we'll talk more about. I'm also on a few boards as well, just to try and see if I can help to address some of these issues at a strategic or leadership level. And I also have my own business as Dr. Hammond's Aesthetics as well. So yes, I do quite a few three different things, but I think it just explores my interest and it helps to keep my love and passion alive for medicine.
Mm, Incredible. Thank you so much for introducing yourself, Dr. Julie. So we have a couple of questions for you to answer. You ready?
Yeah, I think so.
All right. So the first question is, looking at your journey thus far, what really inspired you to, pursue a career as a GP? GP is a general practitioner. And how has it shaped your career thus far? Talk us through.
Yeah, of course. So I think I've always been drawn to like general practice. I did sort of explore other areas as well. So this would include, I was really interested in psychiatry at one point, and also interested in obstetrics and gynecology. And I just found that general practice was the one field that allowed me to regularly see these other problems that I'm so passionate about and love to see. And in addition to that, I also was drawn to general practice because of the work-life balance. I like the fact that I'm sort of based in one location roughly, and that my hours tend to be between 9 and 5. And in addition to that, I was really drawn to the aspect of being able to develop long-term relationships with my patients and also the community as well, and that I get to see them almost and support them through every stage of life, so always from birth to end of life care. And I think this is just really just fed into why I'm so passionate about what I do. And in terms of what I've learned from my role so far, just listening to the different struggles that people have, it just really made me passionate about advocating for personalized and holistic care as well. And I think this has just formed the basis of all that I do. So it's made me want to develop solutions to some of the problems that I see regularly. And in addition to that, I've seen the disparities in care people are receiving. So that's also made me really passionate about championing for diversity and equity in healthcare too.
Hmm, Amazing. I believe that the audience are now enlightened more of the reason why, you pursue a career as a general physician or practitioner, and how it's shaped your career as well. Kudos to you. Thank you so much for sharing your inspiration of that. So that draws me to the next question for you, Dr. Julie.
Yeah, sure.
Like you said, you apart from your role as a general physician or practitioner, you also a clinical entrepreneur. You own your own business. Yeah. So tell us about your company, you founded, and how it supports maternal health and well-being in general. Talk us through.
Okay, so assuming we're talking about Mama, which is my health literacy pregnancy app, which I designed or I'm designing through the NHS Clinical Entrepreneurship Program. And the goal of this app is that I want to empower mothers during what is usually the most transformative and also one of the most vulnerable times in a woman's life or person's life. I want to make sure that when they're going through this period that they feel fully armed with all the information they need to make informed decisions regarding their care. So at the moment, we do have a lot of information available, but often what I found is that this information isn't easily accessible, it's not culturally sensitive, and people also don't know where to go for evidence-based information. Right now, we're currently seeing almost like a pandemic where a lot of people are going online and then be given a lot of misinformation, which they take as, this is facts. And because of that, they're making poor decisions. And I just want to make sure that anyone can make any decision that they want to, but I want to make sure that they're making it using the right information. And even myself, in my pregnancy journeys and also in the postpartum period as well, I find that sometimes I even go on TikTok and go online Googling about certain symptoms, but I just want to make sure that all of this information is just in one place, so you don't get overwhelmed with all the misinformation out there. So it's all about just educating mothers and birthing people and parents as well, and caregivers, and it's equipping them with the knowledge so that they can advocate effectively for their health and well-being, especially with confidence as well.
Amazing, amazing. Dr. Julie, initially you said you do a lot of things. You have a lot of things on your table, and that's amazing. You also, that's really what makes me, sometimes really, what word will I use right now? Really enticed about your journey, because you have a family, right?
Mhm.
And you do things because already being a general practitioner is a full-time job.
Yes.
It can take a lot of the time, but you still find means to do all the things as well. Balancing all those, equations. Amazing. So thank you so much for talking us through about your company. I love the fact you mentioned about creating confidence amongst people, especially the women.
Mhm.
They're seems like they're vulnerable in terms of what they pass through. And kudos to you on you working on the app. And so yeah, I know it's gonna be a great app that will help the maternal health in general and their well-being as well. I think do you know Ruby Jackson?
Yes, I do. I do. She's also in the clinical entrepreneurship program as well, and I've seen her on your channel. Yes, that's someone else I've
Yeah,
seen as
she's
well.
amazing. She's
Yeah.
really an amazing personality. I
Mhm.
think she's paving that path
Mhm.
you're trying to pull together. And but you do a lot on your table. You do a lot, and I'm wishing you all the best,
Thank
and
you.
all the things you need, the
Mhm.
materials you need to bring this app to reality. For the women out there that are vulnerable to get their stuff intact. Thank you
Yes.
so much, Dr. Julie. Now, again, you are the founder
Mhm.
of Hammond Aesthetics. I
Yes.
mean, so as the founder and
Mhm.
CEO of Dr. Hammond Aesthetics, what sets your practice apart in the aesthetics industry? Talk us there.
I think first and foremost, the fact that I am a medical professional, because currently there's a lot going on in terms of beauticians, non-medics also given these services. But because I am a medical practitioner, I feel like I have a unique understanding of the anatomy. So I have I combined my clinical expertise in addition with my deep understanding of patients' well-being as well. And even further than that, I'm also, in terms of how I practice and the results that I like to achieve, I like to achieve very natural looking results. And also I feel like I practice quite ethically as well. So if I see someone and they want something done and I don't agree with it, I don't think they need it done. I think maybe they might have some, you know, I don't want to call it dysmorphia, but maybe have some distortions in how they see yourself and how I visualize them, then I would talk to them about, maybe this is not the right practice for you, or this is not the right treatment for you. And I'm also confident in saying no to people as well if I don't feel like they need to have that treatment. In addition, I just feel like what I'm trying to achieve is that I want to really just enhance patients, or my clients, I call them, that want to enhance their confidence. And also I try to give them realistic expectations, and I try to adjust all my treatments to what I think is going to work for them, rather than what is, beauty standards. Because as we know, beauty standards are quite fleeting. So one minute a certain features in trend, and the next minute it's not. So I don't want to do a treatment that I feel someone's going to not be happy with in a year or so, even though these treatments are not permanent. But I still want to do treatments that I think will best suit them, and it's timeless as well. In addition to that, I also feel like, as a Black doctor as well, I have a deeper appreciation in terms of the certain skin conditions that can affect people with darker skin tones as well. And again, even like I said before about the results that we can achieve, I also understand that as a Black person or an ethnic person, there's certain features that we do have, and rather than trying to erase these features, I just enhance it. So that's how I try to work. And then again, everything I do, I always try to put patient safety, at the front line as well. And I'm always trying to be very transparent with them in terms of the products I'm using, what I think you're going to achieve for the results, how long it's going to last, the risk involved in the procedure as well. So I really take a lot of time just to educate them about going through that process before going ahead. And overall, my main goal is just to make patients feel or clients feel extremely comfortable in their own skin. And so I see the patient or the client more as a holistic person. I try to practice holistically, rather than just treating the particular concerns. I try to see what it is that they need overall. So we have a thorough consultation process before going ahead with any treatments.
Amazing, Dr. Julie. Amazing. Wow. Now, I feel intrigued about something, because I know, because I did pharmacology as one of my courses I did in my third year, and we did about pharmacology is about the processes of producing drugs and all that, right? So, question is, it's not about the production of the drugs, right? That's applicable to your company right now. You guys produce aesthetic products for the clients and customers to make use of, while you educate them on those products. How do you, before I proceed to the next question, how do you deal with the marketing strategies? How do you market your product?
So again, I should just clarify that I don't, do the pharmacology side of it. I don't create the products. I just have a range of products that I can use for my clients. So I tend to base my treatments, again, we'll do the consultation process. We look at their budget. We look at the results they're trying to achieve, and then from that we'll decide what product is best for them. In terms of my marketing, I probably can do a lot better with that. But I think currently, because I've been practicing for quite a while, a lot of my clients I get is through word of mouth. Just generally, just due to my reputation that I've built. So it's people bringing along their friends, their work colleagues, their family members, and then that's how I tend to get most of my business. But again, I'm trying to get better at using things like Google, and also using updating my website quite regularly. So that's how a lot of people tend to find me. But then I can also do things like Instagram stories, and also post there as well. So that's how I go about marketing. I just try to build in-depth relationships with my clients when they do come and see me, and then from there it's usually word of mouth. And if I'm speaking to other colleagues, they tend to say the same thing. People can find you online, but usually in terms of what keeps you going is those clients who keep on coming back to you because they're confident in the service that you provide.
Absolutely. Thank you so much for talking us through about that, Dr. Julie. So we have 3 more questions for you to go. The fourth question for you is, how do you balance your roles as an NHS clinical entrepreneur and an advocate for mental health and women's health? How do you balance those roles?
To be honest, it's an ongoing process. So I wouldn't say that the balance is, in equilibrium right now. Sometimes it tilts one way, sometimes it tilts the other way. But I think mainly, I should first of all start off by saying that with my GP work, it's part-time. So I have a part-time, what we call salaried role. So this is a permanent position working in one practice. So I do that 2 days a week. In addition to that, I can locum 1 or 2 days a week. But if I have a lot of events going on, speaking engagement, conferences, etc., then I may just drop it to 1 day a week of my locum work. So this is like contracting where you pick up an extra shift here and there. And then if it's like completely, extremely busy, then I may not locum for that week or that month. I may just go to my events. So that's one of the ways in which I can balance things. The fact that I don't have a fixed contract where I'm working full time in one position. So that's definitely allowed me to have flexibility. And in addition to that, I must say that I have the most supportive family, husband, that allow me to attend these events and to really pursue my dreams as well. I don't think it would be possible without them, especially having 2 young children. It's so difficult. Being a mother, having 2 kids, family life, being a wife it can be quite challenging and overwhelming at times. And there's sometimes where I do just, step back from everything and just try to take it easy. So that was definitely the month of December, or even from about November, December time last year. I just thought, I need to just slow down a bit. And I did have that period. So it's also, I just try to check in myself quite regularly. And if I feel like I'm doing too much, then I take a step back. And also everything I'm doing now, I'm being a lot more, not focused, but I'm being a lot more determined, or I guess it's picky about what I do. So if I don't feel like any of the things that are coming towards me are going to drive me towards my purpose or my goals, then I'm trying to get better at saying no to things as well. So rather than before, I might have said yes to a few more things than I should do. I'm trying to just be more focused on exactly, is this going to help me get closer to my goals in terms of developing my app, increasing awareness about the work that I do as well. Is taking this additional role and actually allow me to make a difference in the way that I want it to? And if I don't think it aligns with my goals, then I'm saying no to things.
Amazing. It's like I said before, I always say this on my channel. You have to have a supporting system. That's like total summarization of everything you just said. If not your family backing you up, believe me, you would have burned down.
Yeah, no, there's no way at all. I couldn't do it. So I'm so grateful to them that they've allowed me to explore these things, even though sometimes it's like, why are you doing more? That you should sit down and stop, which I do listen to, because sometimes I am doing too much. I need to slow down. So I am taking it on board as well, but also just the fact that they've allowed me and just be like, okay, I see you're really interested about this project, go ahead and do it, we're going to make things work for you. So I'm so grateful to my husband and my family.
Incredible. Thank you so much for talking stereo, Dr. Julie, and how you balance those roles, as an NHS clinical entrepreneur and an advocate for mental health and women's health, which are really important things to focus on, the mental health and women's health in general. So 2 more questions for you, Dr. Julie.
Yeah.
Now, the first question is, what challenges have you faced working across multiple fields, and how have you overcome them? Because I know, like, you have a lot of things to offer to the table. You definitely should have. It's a must that you must be facing 1 or 2 things that are really quite challenging. So how do you overcome those challenges?
So I think, well, in terms of the challenges that I've experienced, even getting into the space where I'm doing so many different things, one of the biggest challenges was imposter syndrome. So I think I did like a LinkedIn post about it, like even creating my app, I felt like I couldn't speak about it. I thought people about, oh, she's doing yet another thing. But I think it's just about being confident in my skill set and knowing that my skill set is diverse and I have multiple interests that I can and should be allowed to explore. So it's just telling myself that no, you can go ahead, you can go for these roles, you can go ahead and do it. So I think that's one of the challenges that I still have to like battle with on a daily basis. Remind myself like, it's okay, actually speak about what you're doing. Like, you don't have to do everything so quietly and secret. And I think culturally as well, we're taught, as I'm Nigerian, and we're taught to not really, blow our horns too much about what we're doing. But I think just being on LinkedIn and seeing what other people are doing and how confident they are in talking about their successes, that's making me take the leap of faith and be like, no, share your story, share your journey. And also I want to share the ups and the downs of what I'm going through as well, rather than just showing the highlights. I want to show that, there are some difficult times in terms of this journey of, being an entrepreneur as well. So that's one of the things I'm trying to do. And I think in terms of just being able to balance everything, I think obviously just being highly adaptable in terms of the different roles and different things that I need to do. So I'm always willing to continually learn on the job about the different, continually learn, go and have training. Also, I'm seeking mentors as well. If I see anyone on LinkedIn doing incredible things, I'm just like, you're amazing. Can we have a coffee just to chat about your journey so far? And I think that just helps inspire me and let me know that it is possible, because I see other people who are further along in the stage of their career than me, and they're doing so much incredible things. And then they've told me that, yes, you need to just be really, really organized, but it is possible to do these things. So I'm trying to be a lot more organized. I have my diary that I, plan every single minute or hour in terms of how I'm going to fit all these meetings and work into my day. And then I'm also getting better at delegating. So one of the things I've recently done is that I've hired a virtual assistant. So I'm hoping that's going to take a lot of the pressure off in terms of having to respond to emails from my clients, having to deal with calls as well. These things should hopefully go through her rather than come through to me. So I'm almost streamlining the work that I'm going to be doing, so that I can manage more of the technical things more so than the day-to-day organizational aspect. So it's still a challenge, and I'm still making sure that I'm working hard to delegate so I don't experience burnout, as you mentioned. And I'm also making sure that I block times off. So I've already got some time booked off in April, because I know that there's a busy period coming up now. So I need to make sure that I plan for the future and know, okay, after this period, I'm probably going to need some time off just to really refocus and just to recover from the intensity of the work that I'm doing.
Amazing. Wow. Man, you're doing a great job, Dr. Julie, to be honest.
It's hard. I don't have it. There's some days where I just feel like I'm just dropping the ball on everything. So this year I'm going to be more organized. So this is why I got my virtual assistant, because there were just too many things that I was missing. And I was like, no, I need to say that I need help. It's okay to need help.
Yeah.
And that's what I did.
Thank you so much for telling us there, Dr. Julie, and how you overcome all this challenging, things you faced, on this multiple fields you're in, Dr. Julie. Thank you so much for telling us there. The last question for you is, now tell us, what advice would you give to healthcare professionals who want to diversify their careers and become entrepreneurs as well? What advice do you have for them?
I would say, first and foremost, not to be afraid to think beyond the traditional pathways in healthcare. Sometimes I feel like, as when a medical student, you're taught to think one particular way and think that, okay, this is the only way that your career can go, but there's other options for you. So sometimes you feel like you're not really enjoying this particular training program or the way your career is going at the moment, it's okay to actually explore other options and to also be confident in your own abilities, that being a doctor, your clinical experience equips you with invaluable skills. The amount of training that we need to go through, we're highly skilled in problem solving and empathy and communication, and these are skills that are all highly transferable to other organizations and other industries as well. So just be confident in that you have the skills to do whatever it is that you want to do. And I think what you should first of all start off by doing is that, just take a step back and look at what you enjoy, what are you passionate about, and also to think about your why and the problem is that you want to solve. And then once you've got that, then I would say start looking at seeking out mentors. Also, I would encourage people to go on things like LinkedIn and to start following people that seem to have a similar career to what they are aspiring to do, so you can see the different things that you can do, and be willing to take risks, but obviously calculated risk. I think as medics we don't like taking risks, but take calculated risks. So if that means that maybe taking a gap year or reducing your hours so you can maybe have a bit more time to explore something else, then do that. And also always be willing to continue learning. So continue going to training programs, continue to go to conferences. Maybe if you find that there's a degree that you're you're really interested in doing, and that might help open up doors for you, then maybe consider also doing that degree as well. And I think sometimes we can also feel guilty when we step away from our clinical care to become entrepreneurs. So I would also say to people that it's not about, you know, stepping away from your clinical responsibilities. It's just finding new ways to deliver your care and also to amplify your impact.
Amazing. That was a nice nuggets there, Dr. Julie. Thank you so much for your time because I know you're very, very busy. So we have to let you go. You're very, very busy. We have to let you go, because you're a very, very busy person. So thank you so much for your time, Dr. Julie. Um, so if you love this content, do well to like, share, and subscribe as well. So if you're wanting to connect with Dr. Julie, her details to LinkedIn, you want to connect with her on LinkedIn and Instagram, it's going to be on the YouTube description below. So head over there to connect with her and follow her journey. She's an incredible personality. Thank you so much, everyone. Thank you for your time as well, Dr. Julie.
Thank you. Bye.
Yeah, amazing.